Welcome to the AA Podcast, our little corner of the web where we are not afraid to discuss tough questions like,
when did nutrition, health, movement, and stress management become alternative medicine?
Where we embrace challenges in all aspects of life to become healthier and stronger versions of ourselves.
And where food and movement are the best kinds of medicine, and cooking meals at home is a revolutionary act. Hello, and welcome back to another episode of the AA Podcast. This is Ashley Olson.
And I'm Andrea Crane.
We are going to continue our series on nutrient deficiencies. So these are signs or things that you can look on yourself and kind of see if you are nutrient deficient. Obviously, these are just recommendations. Like if you feel like you truly do have deficiencies, please see your primary care physician and get your labs done. In our last episode, we did link a couple labs that are super cheap for iron deficiencies, the CBC panels and a ferritin and anemia panel. So you could get those done independently if you'd like, if you don't have a PCP, or if the PCP just charges you an arm and a leg to get them too.
Yeah.
Because I have had that happen. They didn't tell me how much labs were going to be, and I was like very surprised when I got them.
Yeah, and another thing is knowing what your insurance will cover and what it won't, and that can be as simple as making a phone call. But a lot of people don't know that you can call them up and say, "Hey, this is what I want, or this is what my provider wants to order. Will you cover this?"
Yes,
because they're all different. So yeah, information is good. And also, I want, there was something I was going to say about labs. No, it's gone. Okay. Proceed.
Okay, no worries. But before we get started, we are going to share our weekly Bible verse, which, by the way, Happy New Year, Andrea.
I know this is going to be posted, a day after New Year's? And
yes.
Whoa. Yeah. So I have no response to that.
I know. It's kind of surreal, to be honest.
No joke. So my Bible verse was 2 Corinthians 5:17 today. Speaking of a new year, therefore, if anyone is in Christ, he is a new creation. The old has passed away. Behold, the new has come.
That's such a timely verse. Look at you.
Thank you. Thank you.
And mine is coming from Romans 15:13, and it says, "Now may the God of hope fill you with all joy and peace in believing, that you may abound in hope by the power of the Holy Spirit."
Excellent.
Could you just bring your microphone up a little bit? It's rubbing on your shirt.
How about that?
There you go. Okay. Thank you. Awesome. All right, Andrea. So last episode, we talked about hair and nails and did a deep dive on some things that you can look at for nutrient deficiency with that.
Yep.
So today we're going to start with the skin.
Yeah. Well, so for starters, and this might be kind of a no-brainer here, but if someone is really pale, that's the thing I wanted to mention. Okay, hang on. So yeah, and it definitely goes along with this. So that anemia panel we were talking about, if you have anemia, it needs to be figured out. It's not good enough to just say, "Oh, I have anemia," and then go merrily along your way. It really needs to be figured out, because there are some scary causes of anemia. There are some cancers. There are internal bleeds. There are diagnostics that are no joke, and they're scary, and so those absolutely need to be ruled out if you are anemic. So the leading cause of anemia in American women below the age of 50 is chronic blood loss, and that is from periods, obviously. And there are a lot of women who are anemic because they have dysmenorrhea or menorrhagia, which is really heavy and painful periods. And so that also can be figured out. There are
And that's a
Medical.
whole episode
Oh
we want to do.
gosh, yes, yes. We will look at dysmenorrhea at some point here in the new year, probably earlier than later. But yes, all of that needs to be figured out. So don't feel like you have this anemia and you can just kind of live with it, because it affects absolutely everything. This is your body's uh, baseline need is for oxygen, so that needs to be figured out. Okay.
Okay.
So now we can move on. So the first thing that we're looking for in skin is pallor. So pallor is a term that means we get the word pale from it.
Hmm.
So when you're looking pale, when someone is looking pale, if you feel like you are looking pale, um, and some people are just pale. These are the Fitzpatrick types that are like, red hair, light eyes, freckles, just super light people. Um, but if you are lighter than normal, if you have a pallor, this is harder to determine on people with more melanin in their skin. So black and brown people, it's much harder to see. However, if you look at the soles of feet, palms of hands, you look at the tissue inside the mouth, you can tell if it's pale. You can also look at the conjunctiva, or that tissue that's right next to the eyeball. If you lower your lid, and you can see pallor there as well. So pallor, we want to be looking at specifically three nutrients, and that is folic acid, iron, and B12. So folate or folic acid, iron, and B12 all happen to be necessary to make red blood cells. So, if the pallor, most often it's due to an anemia, especially if it's chronic. Like if you're pale because you've been sick or retching your guts out for the last 3 hours because you have food poisoning, well, there's a reason that you're pale, and it's because you're sick. But if it's a chronic pallor, then we look at the anemia and repleting folic acid, iron, and B12. Um, then the next thing I want to talk about are these little keratotic bumps that people sometimes get. So, a lot of times I will have patients say, "Oh, I've got these bumps on the backs of my arms," and they're just kind of hard, little rough, like a little rough patch. So this is most often keratosis pilaris, and it is a hyperkeratotic condition. So you have keratin that. Why are you laughing at me?
Because you use such big words. I'm like,
I'm explaining it. All right. So yeah, as that was coming out of my face, I was like, that may not translate well. All right. So anyway, your thank you for your face, Ashley. Let's see. Your hair and nails are made up of this hard substance called keratin. And in fact, the outer layer of your skin, there's a lot of keratin there too. But it you can have hyperkeratin, or an overproduction of keratin, and then you get kind of these little bumps that we see. Sometimes they're around the ankles, um, that can be called stucco keratosis. But if it's up around the arms, it's generally a keratosis pilaris. And so, what we do with this is generally this is going to be either a B vitamin, a C vitamin, or an A deficiency. So, how do I determine where to start here? Well, I always start with A, and here's the reason why. People in their diets will often get enough of the water soluble vitamins, which are B's and C's. They will often get enough of that, even in a semi healthy standard American diet, which really you can't use the word healthy in the same sentence as that. But anyway, it's it's not that difficult to get baseline levels of B's and C. Um, Now, a A vitamin is very difficult to get in the American diet. It is There's a heavy amount of vitamin A in liver, but
Mm.
people don't want to eat liver. And so the A deficiency is kind of Occam's razor, as we were talking about last time. The simplest explanation is a vitamin A deficiency. Now, a lot of people will tell you, sometimes I'll have vegetarian or vegan patients, and they often are deficient in vitamin A.
Mhm.
And the claim is that, well, if carrots have a ton of vitamin A, that's the vegetable that makes you see better, or orange vegetables in general have a lot of vitamin A. Well, they really don't. What they have is they have beta carotene, which can be converted to vitamin A in the body, but a lot of people aren't efficient converters. And so the beta carotene will build up, and excuse me, and then they will still have this A deficiency. So a couple of things that I'll look at. So I'll look at their nasolabial folds. So this is the part of the skin. If you're familiar with aesthetics at all, these are called the what are these, like, the is that called the marionette lines?
Oh, I
Yeah.
thought they were laugh or these are laugh lines and then
Yeah, I think they're the marionette lines. They come down from the tip of the outer lateral edges of your nose down to your lip. All right. So those are called nasolabial folds. And as we age, those kind of indent and get thicker. But if those are kind of orangey, there are a lot
mm,
of sebaceous glands that exist there. And so the body, if you've got a lot of beta carotene that is not being converted to vitamin A, your body will exude the beta carotene in these sebaceous glands. And so I'll look at those nasolabial folds, and if they're a little bit orangey, or I'll look at the hands, if the palms are a little orangey, then and they have the bumps on the backs of their arms, then I will have them take cod liver oil or vitamin A. I prefer cod liver oil because it has a ton of other things in it, like vitamin B's. Um, but yeah, vitamin A is great for that. And the next thing I want to talk about is bruising, also called purpura. Um, but bruising is something that you want to get evaluated. If you are bruising easily, there are certain types of cancers that need to be ruled out, blood cancers that you need to, get some lab work done and just make sure that you're okay. And then once that's done, then we can talk about why are you bruising so easily. So clotting factors, you might be taking a ton of fish oil, which is great, but that can mess with some clotting mechanisms, etc. It can make you a little anticoagulated, so you get bigger bruises when you bump yourself. Um, Now, also, you can have a vitamin K deficiency. So, vitamin K is involved in the clotting cascade. And so, if you're not clotting efficiently, then that could be a vitamin K deficiency. And vitamin K is found in leafy greens. And I always recommend a lot of leafy greens. Oh, go ahead.
well, what kind of leafy greens? Any
Mm,
kind or
yeah,
any kind specifically?
any kind. I like spinach. So, generally, it's gonna be like the dark leafy greens, the darker, the better. So, things like collard greens, things like kale, even though kale is yucky.
You can make it not as yucky,
I know,
but
and I
it's the
do.
process.
Yes, I cook with and I eat a lot of kale. I grow a lot of kale. I eat it because it's good for me, not because I like the taste. But
Mhm.
dinosaur kale, lacinato kale, is a really deep green, and that's got vitamin K. Spinach has a ton of vitamin K. Um, so yeah, that will up your vitamin K levels. If you are currently being anticoagulated, like on a Coumadin or something like that, you want to check with your doctor before you go adding a bunch of leafy greens, please. Um, Also, vitamin C. So this is really interesting. Um, People with scurvy, okay, they will have bleeding gums.
Mhm.
And the reason is because a lack of scurvy is a profound lack of vitamin C, but even a subclinical lack of vitamin C. So you don't have scurvy, but you still don't have enough C. Um, that can cause a weakness in blood vessels. And so you'll get easy bleeding. All right. So, people with frequent nosebleeds, one of the first things that I do is I have them take 1 to 2 grams of vitamin C a day and see if that will strengthen those blood vessels so that they don't tear so easily. The other thing is folic acid, um, because, folic acid is good for strengthening keratinized tissues like hair, also can help with the bruising or purpura. And then we'll go to numbness and tingling in the hands and feet. So
Mm,
this isn't really skin, but it is a signal that's sent from the skin to the brain, which you want to look at B12. Now, again, I have to give this disclaimer. So, this is kind of a classical telltale sign of diabetic neuropathy. And so, you really, really want to get like an A1C, a fasting blood glucose. And have this checked out with your provider, just to make sure that you don't have some, diabetic pathology going on. But barring that, then you can look at B12 and adding B12 into your day. And that, because a lack of B12 can cause numbness and tingling in the hands and feet.
mm, okay.
Now, this is probably my favorite one of the whole series. And this is this weird diagonal crease of the earlobe. And this is called Frank's sign. It's so random and I love it. It's like if you see this super deep diagonal crease in someone's earlobe, hopefully not your own. One, it could be that you slept on your ear wrong. So if it's only on one ear, your that collagen that makes up your ears, it can crease. And so you want to rule out the fact that you may have been sleeping on it wrong. But if it's on both ears, and this happens, it's related to atherosclerotic disease. So that is like plaquing in your arteries. This is a big deal.
Mhm.
We don't know why. We don't have any idea why it's related, but it seems to happen over the course of time as we age. So, if this is someone like in their early 20s, in their teens, and they've got creasing in their earlobes, this is not Frank's sign. That is something else. It can be a genetic thing. It can be, some other condition, dermatologic condition, maybe. But Frank's sinus specifically, it happens as we age. So 30s, 40s, 50s, you'll see this start to come up, and it is related to coronary atherosclerotic disease. Now, I say related, and what I mean is it is correlated, not that it is causative, not that it is like we don't even know the mechanism or for why this happens, but it is definitely correlated. So, if you see this on someone that you love or yourself, you want to get them checked out. Get a lipid profile done. See what your cholesterol panel looks like. Beyond that, I also recommend, and this is more in the functional world, and I don't know why convention doesn't look at this a little more thoroughly, but I always will get a coronary calcium score on my patients, and this is another imaging test where they will look at the coronary arteries and they will see if there's any calcifications on them, and they'll give you a score of how likely you are to have a cardiac event or a coronary event. Okay.
That's cool.
Yeah. Yeah. So Frank's sign.
So, like, would that be a good one to just, get on a yearly with your normal blood panel?
You know what? No, no. This is kind of a one-time deal,
Oh,
and usually they'll come back okay. Um, However, correlated with Frank's sign, I don't know. I have not been in practice long enough to have a large body of data to look at. Um, But if I'll tell you, if my ears were doing this, I would be getting in for that coronary calcium score just to see where things are. And then the frequency of that testing ongoing would be up to your provider. And that would be a very individual kind of thing.
Okay.
Yeah.
Very cool.
Yeah. All right. And so that's really all I have to say about the skin. Obviously, I mean the more obvious things, if your skin is super dry, if you have eczema, if you have, other skin conditions, atopia, if you have dermatitis, all of those things, your provider should be able to help you manage that. But eating lots of protein, eating lots of good fatty acids, staying hydrated, all of those things apply for good skin health.
Okay. Awesome. Yeah, and I was gonna mention too, like growing up, the bumps on the arms, I was
Mhm.
kind of always told those were allergies, allergy
Hmm.
bumps, but not necessarily.
No. No. Yeah, I'm trying, and usually like if it's kind of we call it kitchen medicine, right? If it's something that's been handed down, there's usually some truth to it or some reason for it.
Hmm.
Um but I can't think of why that would be, unless vitamin A is absolutely required for proper immune functioning. And so, if you are lacking in vitamin A, your immune system will be off. And so, that certainly is related to allergies. So, who
Which
knows?
makes total sense
Yeah.
with some of my family history.
Okay.
So
Yeah.
yeah, I never really had it, but
Mm,
family members did. So
okay. Um, all right. So now we're going to move on to your mouth and your tongue. Um, and
which when Andrea's like, "Hey, open up your mouth,"
I
with
know.
upon meeting her, I was like,
Stick your
"Excuse
tongue
me."
out.
Yeah,
Let me take a look there.
yeah.
Yeah, so what Ashley is talking about is with a couple of B vitamin deficiencies in particular, you can get this scalloping of the tongue. And
Which yeah, I've been kind of bad on my cod liver, so
oh yeah.
I have a little bit, but it's
Okay.
not nearly as pronounced as it used to be. And I
See?
used to tell Andrea, "Stop stressing. That's just because of my tongue, my teeth indentions on my
Right.
tongue."
Except, yes.
It
So
was
see,
not.
aren't you glad I went poking and prodding? Yeah, so when your tongue swells, it will press against your teeth and it will give you this scalloped indentation. Um and so it's sometimes called wavy tongue, sometimes called scalloped tongue. Um there's another thing that it's called too that's weird. Anyway, I can't remember. But yeah, if you see this, it's because your tongue is swelling. Now, the reason that it's swelling can be from a number of things. It could be due to an iron deficiency, okay? Or probably easier to test for um, just by trial and error to see what it responds to. Easier to do that is to replete B12, B2, and B3. So if you're listening to this and our previous episode, you're probably starting to see some themes here. B vitamins, super important. And so one thing that I do recommend people take is a B complex, a good B complex vitamin, and make sure, because you want the best absorption that you can get, make sure that they are using methylated forms of B vitamins. So that would be like a methyl. You don't want a cyanocobalamin, you want a methylcobalamin for B12 in your B formulation. Couple of kinds that I like, we'll put them in the show notes, and those are just examples. But if you do buy a B complex, make sure that you flip the label over and look and see if they are methylated Bs. For instance, you want a methyl tetrahydrofolate versus just a folic acid.
Mm.
Okay, and a methylcobalamin. All right, so yeah, iron. Now, your tongue can also kind of swell because of dehydration, or if you're a smoker. That irritation, that constant mucosal irritation, can also cause your tongue to swell. Um, Now, there are also conditions where the tongue will get really red and sore.
Mm.
And that's also a B vitamin deficiency. So that is B3, B6, and B2, or niacin, pyridoxine, and riboflavin. Um, so you can see, like, there's just an awful lot with B vitamins here. So if you take a good multi, a good B complex, and a lot of times I'll ask patients, are you taking B vitamins? And they'll say, well, I take a multivitamin.
Mhm.
That's not good enough.
No.
Multivitamins often are only they'll only put enough in there to stave off index diseases. So index diseases are the diseases that for which the vitamin was discovered. So, for instance, vitamin C was discovered because of scurvy. Okay. I believe it's a niacin deficiency was discovered because of pellagra. Vitamin D was discovered because of rickets. So those are called the index diseases. And often, you need very baseline level of those vitamins to make sure that you don't get those horrendous diseases. But that doesn't mean that you're going to function optimally. So vitamins, multivitamins will often contain just enough to keep you from getting the index disease. Um, Now, let's talk about a medial fissure or a medial crack of the tongue. So if you open your mouth and you see a longitudinal crack all the way down, I can't see it. You're too small on my screen. Um, if you see a crack down the middle of your tongue, often that can be indicative of an autoimmune disease in specific, like Sjogren's or psoriasis, will have that longitudinal fissure. Um, and then there's actually a condition called burning mouth syndrome. And often that is due to a B2 or riboflavin deficiency. So, again, a good B complex is key here. Now, everyone is going to be familiar with this, or I would assume most everyone, but this is called angular cheilitis or angular stomatitis. They're a little bit different, but you can treat them the same. When you get those raw corners
Mm.
of your mouth. And sometimes it'll just be one and sometimes it'll be both, but it's super painful and sometimes it'll kind of crust over and yeah, it's ridiculous. Um, this you can also take riboflavin or B2, pyridoxine or B6, and B12. So again, with the B complex, if you have a good B complex, then angular cheilitis or stomatitis should not occur. Now, I also want to give this caveat though. These the kind of raw edges of your mouth can also be due to a yeast overgrowth. So, if you wake up during the night with a super, super dry mouth, or you wake up in the morning with a super dry mouth, chances are really good that you are sleeping with your mouth open. If you're a side sleeper, this can cause you to drool out the side of your mouth. All right. And so, in that moist environment on the corners of your mouth, because we're already colonized with yeast, like we have yeast everywhere and we're supposed to, it's a normal thing. Um, but you can get yeast overgrowth in the corners of your mouth because the saliva is, collecting there as you sleep because you're sleeping with your mouth open.
Mm.
So, yeah. One thing that you can do for that is you can put like some type of either like a petrolatum based ointment, kind of like an aquaphor. That's probably
Mm.
my favorite is aquaphor. But it's a really uh gosh, it's a thick ointment, right?
That's actually what I use for my
Ah,
chapstick is
yes.
Aquaphor.
Yes,
Mhm.
absolutely. It's fantastic.
Mhm.
So if you put that on the corners of your mouth, you can also do mouth taping, but that's probably an episode for another day. But yeah, you put that aquaphor in the corners of your mouth, and that will create a barrier to moisture.
Mm. Okay.
And then finally, this is probably my favorite one in the mouth and tongue category is ice pica. It's so weird. So when you have an iron deficiency, now this does not occur with everyone with an iron deficiency, but a really profound iron deficiency, which is anemia, that can cause ice pica. Now, ice pica, super weird. Pica um, is a word that means that you crave to eat things that are not food. So,
Mm.
pica, just plain old pica, is when pregnant women used to go out and eat dirt, right? Have you
Oh,
heard of that?
I haven't heard of the dirt, but is this where like the crushed ice or the sonic ice comes in too?
Potentially, yes. Yes, there are a lot of people with iron deficiency and they will crave chewing ice. Again, we don't know why. There's no iron that you're getting from ice.
Mm-mm.
No rhyme or reason to it. There probably is, we just don't know. But yeah, so if someone is craving ice to chew, then you want to check for an iron deficiency.
Very interesting.
Yeah. Okay. And so to kind of round this out, I just want to give kind of a blanket recommendation for well, there's something up there and I don't
She
sorry
just starts
guys.
looking, staring at the corner of her room like,
There's there's a box in my closet here and I don't know what it is. So I'm going to have to get that after we're done. Um yeah, so anyway, recommendations, blanket recommendations that I can make would be one, get checked out. Get your
Mhm.
basic labs drawn. Make sure that you are being seen and followed by a provider who will look at your lab work and who will look at it every year just to make sure that you are not developing something. So,
Mhm.
then, if we're going to talk about supplements and nutrition, one, get enough protein. Please get enough
Yes.
protein. That is absolutely critical. And we have episodes on this. So, if you're having trouble getting protein, go back, look in our archives, maybe listen again if it's been a while since you've listened. There's some really great tips in there for getting enough protein. And then I consider cod liver oil to be a food rather than a supplement. And so it's got, oh my gosh, it's got B vitamins, it's got vitamin A, it's loaded with vitamin A, it's got omega 3s. Um, it's an incredible food that I think
Yeah.
should be a part of everyone's regimen daily. And then make sure you're getting enough B vitamins as well. So if you want to eat liver, um, liver is loaded with Bs, or take a B complex if you are fussy about your eating. And then, yeah, that's what I got today.
Awesome. We will link the Nordic Naturals cod liver oil in the show notes,
Yeah.
and as well as the B complexes that Andrea likes the best,
hmm
so that you can see
And
what they're all about.
there are two other varieties of cod liver oil that I also like.
Okay.
So I'll put those in the show notes as well. But yeah, Nordic Naturals is kind of my classic favorite, and then there's a couple other ones that I like as well.
Awesome. Perfect. Well, again, as always, thank you so much for listening. And if you found this episode insightful, informative, or maybe you're like, hey, I think somebody needs to listen to this, please do us a favor and share it with your friends and family. And of course, give us that thumbs up, or I think on listening platforms, it's technically the stars.
hmm
So, whatever platform you're listening on, please give us a rating. 5 stars, please. No four. Like,
No
come on.
four. Come
Like,
on.
just do 5. It's fine. And then
That's
tell us how we can improve.
that's that's right. Well, and
um,
can I put the call out for questions too?
yes,
If you have questions about anything that we've talked about, if you have questions about a topic we haven't talked about, or ideas for an upcoming show that you would like to hear, please let us know.
absolutely. We obviously are constantly brainstorming on ideas that we think you want to, but honestly, listening from you, hearing from
hmm
you, and getting what you're wanting to hear from us on, that's what we want to talk about. So, uh, our contact information is in the show notes. So, hit us up, and we will talk to you on the next episode.
Bye, guys. The content provided in the AA podcast is intended for informational and educational purposes only. The podcast is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The information and opinions expressed in this podcast are solely those of the individuals involved and do not constitute medical advice.